So the Kwame Nkrumah University of Science and Technology, as we know, exists to advance, science and technology, and as Ghana's foremost, science and technology university, we have to engineer ways, the flexibility, the adaptability, and creativity in teaching and learning, which ensures that we deliver our mandate to the best of our abilities. So as far as the university structure is concerned and our vision is concerned, we want to ensure that, of course, we're part of the top 10 universities in Africa, not just the top destination for quality education, but all the issues that go with education. And in this case, what we are championing is a solution that we believe will transform the next generation student. Student-centered, problem-based learning. This, we believe, is the way to go. And this is what we're pursuing as a university.
Yes. Until recent times, the teaching of pre-clinical, or what we call the basic sciences for health-related program has been separated from the clinical aspect. And that is what some of us were trained. So immediately you enter into the clinical levels, you are supposed to integrate or find a way of connecting the two. And the training of healthcare professionals has changed to the mode where there's integration between the pre-clinical programs, or what we call the basic sciences, before the clinical program starts. That is where we see translation of the knowledge in the basic sciences to that of the advanced levels or the clinical levels. There should be a connect. And in a recent survey or exit survey conducted by the college among students who graduated last academic year, it came out that most of them complain about the issue of that disconnect, where they wish. And apparently some of them who had the privilege of having some level of training in the course of their program outside the country was able to appreciate the significant role that the integrated form of teaching has made. So based on the outcome of that survey, we decided to engage the various deans and then HODs as to how we can approach it. So based on that, we said there's a need. Whether we like it or not, that is how, at a global level, that is how healthcare professionals or students are being trained. So there's a need for that integration. Let me give a typical example. If you come to pharmacy and you are talking about chemotherapy, a medicinal chemist will come and talk about the structure, how it affects the functions or the pharmacological activities, and that of the clinical microbiology or the microbiology will talk about the infections, and then the clinical level, that is in the case of pharmacy, that is a pharmacy practice or clinical pharmacist who will then also come on board for the same course, so that right from onset, the student is able to appreciate from how the microbial agents progress or proliferate, and also how chemical agents are used to interfere in their growth pathing, and where, in terms of causing infection, where the clinician will also come in and then also teach. So at the end of the day, it improves the way questions are asked, where the focus is on the advanced form of assessment, that is synthesis, evaluation, and application. So it's in light of this that the college has taken that initiative to start this form of integrated or case-based form of teaching and learning. We are aware that it will take some time for all the faculty to be on board. So for me, my target is the early career lecturers and researchers who are involved in the training of students. If they are able to appreciate that, they can easily take it on board and then initiate it. We are hoping that also the senior professors will also come on board. Apparently, some initiatives were made over the years, but due to one or two issues, they were not able to implement it. So we are hoping that with this 4-day retreat for the teaching staff in the College of Health Sciences, we are hoping that we will be able to bring them on board, or everybody will be on the same page, and then we will start, at least if at each department or the schools and faculties offering composite program, they can at least select 1 or 2 courses that they can start with, that is implementing it, and then based on the challenges or the pros and cons, we can then adjust and then see to it that in the near future everybody will come on board. It's my firm belief that in this modern way of teaching, it's more to do with facilitation. If the students are able to appreciate what we intend to not necessarily teach them, but for them to know, that is the knowledge acquisition, they will be on board. And I think in the long term, it's going to improve the practice, wherever practice area they will be it pharmacist, nurse, medical doctor, dentist. And to me, we will start in a small way to change the face of the health practice or medical practice in the country.
Thank you very much. The College of Health Sciences of KNUST is at a retreat today and throughout the week at Sunyani, looking importantly at the way we deliver lectures to our students. We are a health training tertiary institution. We train doctors, pharmacists, physician assistants, medical laboratory scientists, nurses, midwives, veterinary surgeons. Okay. And central to our role eventually at the service level is providing the best of healthcare to our patients. Okay. So during our teaching, we want to, as much as possible, be teaching in a way that will be close to what our patients need, wherever they will be. Okay. So we are thinking more of case-based approaches to our teaching. Where the delivery of our lectures, our examinations, etc., will be based on what we actually see in clinical practice. We want to move away from more of a didactic, theory-based, whatever, to case-based approaches. But it is central to this is also the fact that because healthcare is delivered as a team, doctors, nurses, pharmacists, lab scientists, whoever, we also want to train our students in an interprofessional approach, which means that we have modules during the training, okay, which modules will be taken by groups of health students, okay, so that these modules you can have, depending on what the module is, could be taken by nursing students, pharmacy students, medical students together. Okay, so everybody understands each other, the contribution they provide as a team in the care of the patient. You know, it's always frustrating when people go to hospital, when healthcare professionals would deliver our services in silos. The nurse does their bit, the doctor does their bit, the lab scientist does their bit. Okay, all not thinking about the fact that the ultimate goal we want is the best for the patient. Okay, so if we all know that we have a role to play, there's our role, that's your role, which together bring the best for our health systems. That's the way we need to be given. So interprofessional education really has to do with delivering teaching and learning to our students, where we train our students together. Okay, so there will be some sessions that various groups of students will join. Okay, not only doctors in training, pharmacists, etc., but doctors, nurses, pharmacists, or even our vet surgeons. I mean, the truth about what is happening in the world recently with all these pandemics is that most of them are coming from animals as a source. Okay, so our vet scientists have a role to play there. But the point is that when people are eventually affected, right, they then is the human doctors who take care of the nurses, etc. So if you deliver teaching to all these groups at the same time, okay, then they understand the role they have to play when somebody has rabies. Okay, they understand the role they have to play when somebody has any of these emerging diseases, which spans across what we call the One Health concept. I mean, our teaching modules in the college are based on a One Health concept. Okay, it is time that we train our students in such a way that they all understand each other's role in the healthcare, training them together and not in silos. So this is our approach our provost want us to look at. Okay, so I chair a committee that is looking at this, that is looking at for best practices globally, so that we can fashion a curriculum around that. And as you could see from the talk this morning, everybody's excited about that really. We also want to have a look at how students will also take this up. So whether it's just courses they need to audit during their time in the university, or whether they need to have credit for it. Okay, but it definitely will be a requirement before their graduation. But as to that, whether that requirement will come in the form of specific credits or it will just be one that they need to audit, it is still under discussion. And as you heard through the discussion, most people are in favor that it has to be a credit system so students can attend, okay, and be serious about it, because there are going to be exams out of it. So this is the theme of IP, or intra-professional education, that our college will be rolling out in due course.
Today being the day one of the College of Health Science retreat, I'm very excited and I'm very happy to be here. I'm glad I came. If I had not come, I don't know what I would have lost, because so far the introduction to the upcoming retreat itself is very appetizing and enticing, and I really look forward to the next days. I hope that with our team of quality education and implementing an integrated and case-based learning will give us some high level of skills and also improve on what we already have, to be able to give out in our teaching, to be able to deliver a very good teaching skills. Yes, we have been doing our best considering the large numbers that we have and all. We are struggling with how to really get them to be problem-solving centered, and also how best to integrate the various professions that we have so that we approach healthcare holistically. I'm hopeful that by the end of this 3-day retreat, we'll be able to achieve an integration of the professionals that we have. Thank you.